hospice, palliative care, and pediatric patients across 41 counties here in Kentucky and southern Indiana. The nonprofit organization is able to support their patients and their families in the most difficult times. Joining me today with more on all that they do and how you can help support them is Chief Medical Officer Dr. Bethany Snyder. Thank you so much for joining us today. Such an important topic. Why is it, do you think, that families don't call sooner? And why should they call sooner?
Yeah, it's great to be with you today. And unfortunately, in our country, many people think of hospice just for the last few days of life.
Yeah.
But it really is designed to support patients and their families for months. And we surround them with a team of experts that really try to improve the quality of life, thinking about physical needs, spiritual, psychosocial, and emotional. So I've had the blessing of being with many families through this time of their life. And you can see with more time, we can really help them create more moments and check off some of those bucket list items, even when they are facing a serious illness.
Yeah, we heard recently about your national ranking, 4th in the nation. Tell us about what that says about the quality of care you provide.
Absolutely. So we're really blessed at Hosparus to have received the number 4 ranking in the country out of the top 50 hospices. It looked at not just quality, but our employee engagement and really our family satisfaction. And so what that said is we are so blessed in our community to have an organization that's a not-for-profit that really prioritizes the needs of our communities and takes our dollars and invests it back into creative programs so that we can meet the needs of all that are touched by serious illness.
What do you think is the biggest misconception out there about hospice care?
Yeah, as we mentioned earlier, I think it really is around hospice being for days.
Yes.
So sadly,
That's new to, like hearing you say that even, I'm like, you know, people don't think that they could do that.
Yeah. So hospice in our country, typically people have for 2 weeks or less.
Yeah.
When it really is a benefit designed for months. And so I think we work hard to educate our communities and grateful for partners like you all that let us share the message that we're really there for all impacted for serious illness. And that's what led us to create some alternative services to really try to meet people earlier in the disease so that we can wrap them with these services to improve their quality of life.
That's actually my next question, those other services, because you're no longer just hospice care. You offer so much more, and I know you all have been working hard at that the last couple of years.
Yeah, we saw a gap in our community about 10 years ago around patients that weren't yet eligible for hospice, or maybe they didn't qualify for hospice at that time, or their goals just weren't hospice. And so we created a robust palliative care program that serves patients in our community with advanced illness. We also have a pediatric program that you've heard about that also serves children and adults that have palliative care needs. And we've recently started a PACE program, which is a program of all-inclusive care for the elderly. So we really see the continuum of serious illness as the population that we want to serve.
And is it just year after year listening to folks and understanding the community that leads you all to develop so many new things?
It is. Healthcare's changed a lot, as we've all experienced, and people want care in their home. And what we try to do is to find solutions for them with their serious illness. One exciting adventure coming up for us is we're going to build the first freestanding inpatient hospice unit for our community, and that's another way. How can we meet the needs of this seriously ill population, but make it feel more home and more comfortable to them? And so our organization has been blessed by a board that really supports us investing in what our communities need and creating these solutions for them, not just one standard serving, but what does that family need and how can we meet that need?
And you've been in the position where you're not only interacting with the leadership of what you all do, but also with families. So when you are with families, you probably hear and see firsthand the impact that you all have.
It's an honorable job to do the work that we do, and I tell families every time I take care of them, it's so much more of a blessing to us as the care providers than we can ever be to them. To walk alongside someone that's facing the end of their life and to be invited in to those moments to support them and to encourage them and control their symptoms, like I couldn't think of a greater blessing for myself as a care provider. And so we just want people to know that we're there to serve them and to support them, and it is a humbling experience.
It certainly is. Thank you so much for thank you for the work that you all do. on creating these wonderful programs. So if you would like to support the work that Hosparus is doing this season, all you have to do is head to hosparus.org/donate or use the QR code on your screen.